With travel restrictions being lifted for fully vaccinated Canadians, many are looking forward to hopping on a plane and getting away, though first they'll have to stop at a pharmacy like this one here on Danforth for a COVID test, and it'll cost you. However, there's a loophole, and some are concerned that people might be skipping out on paying for their test, instead sticking it to the taxpayer.
When you think of a family of four that potentially at 150 a test is going away, I guess some mentalities could be the kind to say, you know what, we'll go to a hospital setting or a pharmacy and say, we think we have sniffles or our child might have been exposed. And then they get 4 negative COVID tests and use it to go on a plane. And that saves them a lot of money.
211 Ontario pharmacies are currently offering COVID tests to travelers and others. To receive a pharmacy test, you have to be asymptomatic and go through a pre-screening process. If you fall into a priority group, such as a farmer, childcare, or long-term healthcare worker, the fee for the test is covered by the government. If you are traveling internationally, you must pay anywhere from $100 to $200 for the gold standard PCR test, or depending on where you're flying, a rapid antigen test.
We do rely on the honesty and integrity of the person who's going through the pre-screening COVID process.
Some nurses, pharmacists, even travel agents are expressing concern that this loophole is being exploited, though it remains unclear how many people are falsely identifying themselves to skip out on paying for a test to travel.
It would be extremely frustrating as a taxpayer that people have zero issues with them, yet are walking into a facility and suggesting they do, only to get the negative COVID test so that they can get on the plane and fit all the requirements.
The Ontario Pharmacists Association is also flagging another potential issue: the number of available pharmacies where you can receive a test. Of the more than 4,000 in the province, 2,000 have indicated they'd like to deliver the service, but only 211 pharmacies are currently part of the pilot project. With travel demands ramping up, appointments can be difficult to come by. The association also believes one way to close the testing loophole is for the government to cover the cost of all COVID tests, especially those traveling for essential reasons.
Our best interest in the province is to make it as accessible and convenient as possible. Testing is a big component, as well as contact tracing and the vaccination program, for keeping people safe and healthy and keeping the economy open.
The Ontario Pharmacy Association is also lobbying the provincial government to use pharmacies for teachers, staff, and students to come in the fall to receive free antigen tests. We'll have more on that in the weeks ahead. I'm Adrian Ghobrial for City News.